Hi, this is Dr. Robert Brueck coming to you with another segment, What's New in Cosmetic Surgery. If any of you out there listening would like particular topics discussed or have questions about a procedure or a product or whatever, you can contact me. My phone number is 239-244-2329, or go to my website, beauty.brueck, send me an email. So we'd like to hear your comments, any ideas, suggestions of things we can cover. And what I do in these segments is I try to go through the plastic surgery literature, mainly cosmetic surgery, and discuss some of the new techniques, new products, new ideas that are coming on the horizon. The first thing I want to talk about today is a new type of implant, and I had mentioned it in some previous blogs, and one of it, and the name of this implant is called the B as in boy, Lite, L-I-T-E. It's an implant that was developed in Israel, and I just read another follow-up article about this. It's not yet FDA approved here. The company is in the process of getting approval for the product, but as yet it's not available, but hopefully sometime soon. The whole idea behind it is, many times women come in to see me for breast augmentation, and one of the questions many of them ask is, am I going to gain weight? Of course you are. We're putting in implants, and of course, naturally, the bigger the implant, the greater the weight is. But beyond that, that heavy implant has an effect on the breast tissue. We had talked about, some people think by putting an implant in there you diminish the volume of breast tissue. It's controversial. But one thing it does do is skin has what we call viscoelastic properties, sort of like a rubber band. A rubber band you get out of the box has great elasticity. It stretches, snaps right back. As that rubber band ages, those properties are diminished. So the idea is, if you have a heavy, big implant in place, and again, it depends on how you go ahead and support your breast. For example, some women go around braless all day. That tremendous weight of that implant will take the viscoelastic properties of the skin and destroy it, weaken it, lessen it. And then you couple it with somebody that, for example, goes to the beach all the time or by the pool and is aging their skin through sun. So the idea is, the bigger the implant, the more likely it'll affect the shape of the breast, and as you go ahead and pass in years, your breasts will start to sag more. And more women, I see this in patients of mine that I put implants in 6-7 years ago. They come in now and they need to have the breast lifted. And you can't restore the skin to when you were 16. But it's important to understand, and the idea behind the BLine implant is, if we could put an implant in, the same volume, but 30% less weight, and that's what they project, then you're going to have less effects on the viscoelastic properties of the skin, i.e. less ptosis, less sagging. Now, the BLine implant is a silicone implant that has borosilicate molecules in it, and these are big molecules that don't leak out of the implant. They've done all kinds of extensive safety studies, breaking them, do they migrate throughout the body, whatever, and it got European approval as being safe and efficacious. And again, those individuals are now working on FDA approval. And it makes sense, if you could put an implant in place that's safe and weighs 30% less, it'll affect the skin envelope and the stretching of the skin less than if you have a conventional implant. So it's an interesting topic, and I'll keep you posted if something comes up. One of the other things I want to talk about is, every time I turn around, it seems there's a new indication for Botox. And I didn't realize this, but many physicians are using Botox to alter muscular fullness. Sometimes women come in for a facelift, and they'll have big masseter muscles here. There are actually some individuals that are injecting the muscles with Botox. I saw an article where some physicians were injecting Botox into calf muscles. In other words, some people have these big calf muscles and they find it unfeminine, unattractive, whatever. So the physicians will inject Botox into the muscle to get it to shrink or lessen. What's interesting is, once you stop the Botox injections, the fullness of the muscle will return. And that was always one of the big concerns I had. People were injecting Botox on the forehead and the glabella. What are going to be the long-term effects of the muscle? Will it atrophy and create indentations or depressions? But in this study they found that once you eliminate and stop the Botox injections, the muscles will come back. Another thing I want to talk about is diabetes. A lot of the patients that I treat for cosmetic procedures, facelifts, tummy tuck, many of them have diabetes. And there are basically two types of diabetes. There's type 1, which is juvenile diabetics, and they usually require insulin to maintain a steady sugar level in their body. And then there's the adult onset. Many times it's affiliated with obesity and things of that sort, poor diet. We call that diabetes type 2. Well, there was a study done that included 129,000 patients from 2008 until 2013. And they reviewed these patient records to see once the effect of diabetes on complications, major complications, in all different types of cosmetic procedures. And what they found that of the 129,000 patients, there was a combined total of 1.9% of major complications. Okay, and it depends on the type of procedure, whatever, but overall 1.9%, which is very reasonable and acceptable. Now the question is, of those individuals, how many were diabetic and how many were non-diabetic? And what they found was the diabetic individuals had a major complication rate of 3.1% versus 1.9% for the non-diabetic. So there seems to be an increase in the frequency of complications, major complications in people with diabetes. One of the things that I think we see more often with diabetics is a higher incidence, for example, of wound infection. And I think it's due to the fact that diabetes will affect the small blood vessels in the tissues. In order for tissues to heal, you have to have good blood flow. And many diabetics will have small vessel disease. You hear this all the time. That's why, for example, getting an ulcer on the leg to heal in a diabetic is certainly a greater challenge than it would be in a non-diabetic. So I think it's important, if you're contemplating cosmetic surgery, that your diabetes is well controlled, your sugar levels are well controlled, and this will help to lessen the likelihood of a major complication. Another study that I recently read had to do with tummy tucks and the effect it has on back pain. This was an interesting study. It was done 40 patients. It was done in Turkey, of all places. And what they did was they did pre-op radiographs and looked at the degree of lumbar lordosis and thoracic kyphosis, which is basically a bending of the spine. And these women, 40 women, had tummy tucks with plication. So that's a situation where you take the rectus muscles, you plicate them, and you bring them together. When women get pregnant and the uterus expands, it pushes the muscles away. The net result is you get a bulging of the lower abdomen. So in a tummy tuck, many times what we do is we reposition those muscles to tighten it and firm up. And what they found was that many of these individuals had a significant improvement in their spinal distortions, that is their lumbar lordosis, bending over, kyphosis in the spine, and they had less back pain. Not only that, they measured their psychological effect of the tummy tuck on the patient's sense of well-being. And what they found was that the majority of women, they didn't go into specific numbers, felt so much better about their self-image because they had the tummy tuck down. And I always tell people when they come in to see me for tummy tuck, if you have loose skin and you've got all these stretch marks, don't listen to your husband. If he says, honey, you need another 1,000 sit-ups a day, it's not going to go away. You need to remove it. But it's interesting that if women have back pain, sometimes having a tummy tuck may be a nice solution to that issue, as well as making your abdomen, your midsection look better aesthetically. So something I thought that was kind of interesting. The other thing I want to talk about is glute augmentation. I see more and more patients that come in and want to have a Brazilian buttock lift. Basically what it is, it's a procedure that we do to enhance the fullness, the aesthetics, if you will, of the buttock. And one of the things I find with a lot of patients, they come in, they want this, but unfortunately they don't have enough fat to augment the buttock area. Consequently, they go ahead and are disappointed because they don't have it. And I can't go to Home Depot and buy fat off the countertop. But what they found was in 2002, there were 614 buttock lifts done in the United States. That number in 2014 was in excess of 21,000. So it's becoming more and more popular as more and more people read about it, see the effects. Now, you can do a buttock augmentation lift, call it whatever you will, one of two ways. One, you can use an implant, a silicone silastic implant. Two, you can use autologous fat. Now, previously, the complication rate with buttock augmentation and gel implants was reported to be as high as 38+%. But this article was a more updated version. And what they found was with implants, and I don't do implants, I'll explain that in a second, the complication rate was now 21.6%. Still extremely high. That's almost 1 in 5, or better than 1 in 5. Whereas with fat grafting, it was under 10%. Now, I prefer fat grafting because when you put an implant in there, it's like a breast implant. It can get hard, it can rotate, you can palpate the edges, it can be uncomfortable when you sit on it. So I'm not a big fan of putting an implant into the buttock area. It just, it just doesn't strike me as being the way to go. Whereas utilizing your own soft tissue, it's sort of like 2 for 1. In other words, you get liposuction in an area where you don't want the fat, let's say your tummy or your flanks, and you put it where you do want it, in your buttock. So it's like a more complete mid-body contouring. So I'm very careful when I do gluteal augmentations with fat. The other thing I do is I do not inject the fat into the muscle. I think it's too risky, and there have been many individuals who've had, in fact there was a study out of South America, and they studied the fatalities of this. They're few and far between, but they do occur, and it was always because they were injecting fat into the muscle, and when they were doing that, they inadvertently injected some fat into a blood vessel. And so I do not inject fat into the muscle. I will inject it into the soft tissue overlying the gluteus muscle. But it's a great procedure, but I think it's important to understand, if you're considering this, make sure you eat some banana cream pies before you come in and see your surgeon. So gluteal augmentation, significant increase in the numbers, and a nice procedure. So again, I want to say thank you for listening to us. Again, if you have questions, you can call me at my office, or you want to come in for a complimentary consultation. It's 239-244-2329. And again, go to my website, Beauty by Brueck. You can request an online consultation. You can call me and email me if you want me to cover a particular topic, procedure, product, whatever. So have a wonderful week. Again, we thank you for listening. We look forward to another segment.